For this next question, we're going to focus on the various settings for a current psychiatrist, being opportunities for outpatient, inpatient, variations of different varieties. To please share about your current setting. What do you like about it? Why do you think it's an advantage? And what should residents think about if they're considering going into a setting like yours? For this question, let's start with Dr. Wakim.
Thanks, Mike. So our current setting, as I mentioned early on with the Transformations Care Network, it really is an outpatient mental health platform. So that is, psychotherapy of all sorts, psychopharmacology, and interventional, as I mentioned. As I also said earlier, we do end up covering a lot of inpatient facilities or detox residential programs in some of the IOP, PHP stuff, just as a subset of having a group of providers in an area where there's obviously shortages across the board. So, I'd say the advantage to us is we have the flexibility of kind of creating a job for someone. That could be a mix of tele and in person. It could be a mix of interventional and psychopharm, outpatient. It could be a mix of inpatient in the morning, outpatient in the afternoon. So that flexibility again is powerful. In terms of thinking about what you want to do, it's not mutually exclusive. So some people do only inpatient, some people do only outpatient. You can mix it up. Again, there's the flexibility of inpatient or tele versus in person. So generally speaking, outpatient is much more structured. So it's a schedule. You follow that schedule. People show up. People leave. Inpatient, and so by nature, outpatient's also a long-term treatment rapport and planning, where inpatient tends to be much more in and out, short-term stays. You're the treating provider for a short period of time. You're not kind of their long-term primary provider. And inpatient generally comes with more flexibility. You can kind of create the rounding schedule when you want to and kind of leave when you want to. You have a captive audience there that you're serving, kind of not the other way around. So, how important your day-to-day schedule is, I think is an important piece of what you choose. If you want to be on call or not. If you're generally working inpatient, you're taking, overnight admission calls and, someone's getting kind of wild on the unit. They need some sort of chemical restraint. So there's, outpatient, you're really not on call, especially if you're in a group practice. There's probably someone who's been kind of designated to take whatever not, urgent, rare call there might be for the outpatient practice. So flexibility versus, lifestyle versus, time commitments. Do you want to work weekends, not work weekends? So the point being, they're not all mutually exclusive from one another. And, certain personalities fit certain opportunities better. And that's really what you have to line up as you think about what you want to do. As Dr. Carter said earlier, the jobs are there, the opportunities there, and you can usually get pretty creative about what you choose to do.
Thank you, Dr. Wakim. Let's go to Dr. Carter. Dr. Carter, same question. As you think about your current practice setting, other practice settings that you've worked in, what are the advantages and what should residents think about when they're thinking about their next step and what's the right setting for them?
So I think probably first and foremost is what is your personality? Just like Brian was saying, what it comes down to also lifestyle. What is your work-life balance? We do hard work as psychiatrists, and what can you on your level be able to handle? Are you wanting to see more acute patients that are in the inpatient or intensive outpatient programs? Are you wanting to be kind of like that old kind of family doc that becomes like a family psychiatrist and follow people long term? Are you somebody that's interested in doing more therapy than psychopharmacology? Those are questions that only you can answer. I think it also comes down to, are you someone that's in an academic? Academic institutions, more or less, may have a smaller caseload and emphasis on teaching and research. Or you might be a mercenary. You might be someone who wants to work for a for-profit organization and see 20, 30 patients a day and feel comfortable doing that. It's really based in your own personalities, your own perspective, and the care you want to provide, the life that you want to have. And, you know, as a leader of a hospital, I can just tell you, negotiate for what you want. There's such a shortage. I promise you, they will find a place and plug you in your ideal situation.
Thank you, Dr. Carter. Great advice. Dr. Krugley, same question for you. All the different settings you must have worked in, what would be some of your advices? What do you feel residents should really think about as they're considering what they should do next?
Well, I've always been a hospital-based practitioner. Although the field in general is largely provides ambulatory care. Psychiatry is by and large an outpatient practice. So the inpatient setting, the number of psychiatrists who work inpatient is much smaller than the large majority of people who do outpatient work. I've always, well, until the last 5 years or so, I've always maintained an office, but it was more of a part-time situation at the end of the day after the hospital work. I also was introduced to geriatric psychiatry in the 80s and found a kind of a niche as a consultant to nursing facilities, which is I would call it a niche practice. So it's a facility-based practice, different than hospital. It has its own rules and regulations. It has its own milieu. It's a niche in and of itself, and you can include assisted living facilities in that as well. So what's important is what you feel comfortable doing. I was always felt excited by inpatient practice. I've worked both in freestanding psychiatric facilities as well as general hospitals. They each have, they're different, and they each have positives and negatives. I think what I would recommend for people starting out is to choose a setting that they're comfortable in. I myself was comfortable in facilities, in hospitals, nursing facilities. I like the interaction with the nursing staff, with colleagues, in general hospital settings, with other medical staff, other physicians. Office practice tends to be a little more isolating. I mean, you can be in a group and so forth, but everybody's kind of doing their own thing with their own patients. I think what's important for people in the residency or fellowship stage is to decide whether they want to start out in more of a general kind of practice or whether they want to start out more specialized, forensic psychiatry, child and adolescent psychiatry. I would recommend more of a general exposure for the first few years, especially in terms of seeking out mentorship kinds of experiences. But keep in mind that certainly the large majority of psychiatric providers are working outpatient. So that is where I think probably a majority of the opportunities are going to be. But if you're really interested in inpatient work, you have to seek that out. And again, pay attention to who you're working with. When you're starting out your career, you want to work with people who you can learn from. Very important. So that's pretty much what I would advise people to do at this stage of the beginning stage of their career.